nose had. It looks like
And it's
nose
small
had.
too. It's small.
No, but it looks like the nose.
And it's hard to
had, or
tell
elf had.
sometimes when you're looking independently if it's smaller or bigger.
Okay.
But the centrals have this very symmetrical ice cream cone shape. On the lateral, you have lateral deviation to the distal with the root.
And I know you said that looking at the incisal view, if you like draw a line in the middle, you can tell if it's a
You have it
central.
direct.
On the mandible,
Yeah.
yes.
That one too, no?
And we know it's not a premolar because what do we see on this occlusal surface?
The single.
Decisive edge.
We see an incisal edge and we see a single fossa. What would a premolar have?
Premolar would
It's
have.
going to have that transverse ridge and it will have two pits, front and back,
Uh-huh.
right? So if I'm looking at this, this is obviously a cingulum and not a cusp for a premolar, right? So I know, looking at the occlusal table, it's an incisal. I can see the incisal edge. I look at the root and it's very conical. I know it's a central. Then which angle is sharper?
You would have the mesial aspect.
I look at that edge and that's my mesial aspect. So that means if this is mesial, that it is what? Toward
The
the
midline.
midline.
That would be.
So line it up
Seven.
toward the midline. And which central is that?
Seven.
Right.
The right. Number 8.
Yeah.
Seven is the lateral.
Permanent, maxillary,
Right,
Upper.
right,
central and.
central incisor.
What did you say about the baby tooth had the similarity with the maxillary? I forgot the question. And it just
Which tooth does the first primary molar resemble?
None of them.
no,
None.
no, not this one. They had the roots. They had 3 roots or something like that.
The,
Bifurcated
all maxillary
molar.
molars have 3 roots in both dentitions, both primary and permanent.
Okay, that was my question.
Trifurcation, like a tripod.
Oh, there was one that was like,
That was
what,
all
what molar? Something, something. Was like, what molar has two
That's
nerves?
the
Oh, yeah. Remember that question?
mandibular first.
We have another question. I think she's
Mandibular
Mandibular
first. Mesial root of
first.
the mandibular first.
mesial root of the mandibular.
We'll look at that in a
It's two
minute
nerves.
too. So this is a maxillary
Go
lateral.
over it.
See that lateral deviation? We don't have that ice cream cone that we had on the central where that root, the apex was slightly tapered and the apex was centered. On the lateral, I have a distal inclination. So on a maxillary tooth, we know that that's toward the distal.
Number 7.
That's number 7, sorry.
That would be my incisal edge, which is, or my mesial, which is the sharper
Stuff
corner.
right now to look
If I line that up to my midline, that is
Number 7.
number 7, DAQT. Jason,
The AQT would be permanent maxillary central, permanent maxillary right lateral incisor.
good job. We're good between maxillary central and lateral?
Yeah, especially on incisors. It gets a little trickier when it comes to the premolars, and for me, the molars in terms of what side they're on.
Okay.
And I mean, it might just be me, but
And then the central.
I have some kind of dyslexia with this.
Mandible, is that a central or a lateral?
That would be
It's a central.
A central, because my biggest factor, I look at the cingulum. This is my incisal edge. Is my cingulum centered? If I divide that in half,
yeah.
it's centered, so I know that it is a central.
25 is essential.
On the mandible, which mandibular incisors, what is the deviation of the root? Mesial?
Mesial inclination.
Good, mesial inclination. So this root, which way does it taper, right or left?
Right, towards the right.
So which side does this,
Right side.
That's on the
It's
right.
on the right.
it's a right tooth?
26.
That edge is a little sharper, that's my mesial.
This is just for the anterior teeth?
Yeah.
Yes, posteriors have a little bit of a distal, but anteriors have, on the mandible, a mesial inclination. So it's going to tell you which side it belongs on. If it goes to the right, it's a right. If it goes to the left, it's a left. The left side of the tooth, right. Right and left, looking at the labial view of the tooth.
That helps me a lot.
So that would be mandibular,
Mandibular,
right,
central incisors.
good.
Tooth number 25.
Tooth number 25, good. And do I see my mesial root inclination? I'm looking at the tooth, this is the longer angle, this is my mesial side, my root is tipped this way. I look at my cingulum, is that centered?
No, so it's
The
a
whole tooth
lateral.
kind of, even my incisal edge has that little bit of a warp toward my distal. If it's a lateral deviation, and I look at the crown too, and I see that deviation toward the distal, mesial inclination of the root, which tooth is this?
Tooth number 26. Permanent mandibular, right, lateral side.
Yes,
26, right?
26.
26. So the cingulum is not centered. If it has a deviation lateral, I know it's a lateral incisor. I know on the mandible that the apex has a slight mesial inclination. If that root is deviated toward the right on the labial view, it belongs on the right side of the arch.
Has there ever been a case where the root was distal?
Yes. They can, with dilaceration, you can have all kinds of interesting things that actually happen. Deviations.
But it was just the root that was distal, they didn't have the wrong tooth on the wrong side, right?
We had an interesting case the other day on the floor. The patient had the lateral and the canine were switched. Whatever happened, trauma or something, the buds kind of got
That would look so cool.
together. So, yes, it can happen.
What I mean is like, since the roots are always, mesial, right?
Mhm.
But
On the anteriors,
the anteriors.
they have that slight deviation.
Yeah, exactly. But has there ever been a case where it's
Want me to send you this video?
it's distal and it's actually because the wrong side was, the wrong tooth was on the wrong side?
Not
I
that I
know,
know
that's what
of,
I'm
but I
thinking.
wouldn't
I
rule
still
it
am
out, 'cause,
confused.
interesting things can happen. When the next when we see how teeth are actually initiated, how the the dental lamina creates the buds for the tooth itself. Any kind of trauma or blow or even fever can affect, when the teeth finally come in, the deposition of the enamel or the way it's laid down, stripes of different colors. So it can affect that root also. But in a predictable pattern, In anteriors, they should be deviated to the right, or to the midline, toward the mesial. All the pressure comes from the back, so if that root has just that little bit of pressure this way, and I'm trying to push it, it gives it a little bit more resistance to movement. Does that make sense? So if I'm pushing from those posterior molars, that 100 to 170 pounds of pressure, and I'm trying to shove this tooth out of position, I have bone here, and it helps it kind of hold its ground, pushing against it, and it's touching. So it refuses to, it doesn't want to tip.
Can you go back to because when you say it's the right side, the mesial end could be the right or the left side depending on what tooth it is, right? The mesial is towards the midline?
Yes, if this were permanent mandibular left lateral incisor, it would pretend like this is the labial view of the tooth, it's going to look like that. So my midline would be here, but my root inclination on the left side is still toward the mesial aspect of the tooth. Pretend this is a labial view. So that would be your,
So the mandibular teeth curve to the,
and the mandibular incisors, the root apices has a slight mesial inclination.
Not the canine?
towards the mesial instead of the.
The canine will as well.
And that's only the case with
The
mandibular.
anterior teeth. Yes, on the maxilla, they're distal. They're all distal. On the mandible, the anteriors are mesial inclination, the posteriors are distal.
That helps a lot.
And then maxilla are all distal,
Yes,
posterior and anterior?
yes.
What are the posterior teeth then?
On the mandible, they have a distal root inclination.
So it's
Well, we'll look at the root, like the mesial buccal roots kind of go like that
Mm-hmm.
on those, on the mandibular molars. And then on the third molar, the whole thing pretty much has that distal inclination. But on anterior teeth, it's a slight mesial inclination. So if this is tipped toward the mesial when I'm looking at, toward the left when I'm looking at the labial view of the tooth, then that would be a left incisor. If it's on the right side looking at the labial view, because it's tipped toward the mesial, it's a right. Does that help?
Yeah, but we can't always, we're not always gonna be able to see the root, so how can we tell?
On the clinic floor, you're looking for those incisal
Or
edges.
let's say
and-
we're just looking at an image and we see, like, not the premolars, but, yeah, just the molars.
If this were a clinical, if this were a patient on the floor, where's that? And I'm